Hi, I'm Greg. I'm the lead singer for Lipstick Generation.
I'm Steve, the diseased bassist.
And I'm
And
sorry,
today
I'm
on the
Dr.
Lipstick
Bob,
panel,
the dad.
yeah, we've got a special guest. We've got Dr. Bob with us here to do a little emergency episode, a little PSA about the coronavirus. I know, Dr. Bob, you're on limited time, so why don't you briefly just, give us a rundown on what you want people to know about the coronavirus?
So, coronavirus is related to uh, several not particularly severe viruses that are in common circulation in America, as well as two nasty viruses from the Middle East called MERS and from Asia called SARS. Um, it is a coronavirus that is contracted by droplets in the air or by contact with a contaminated surface. And then you rub your eyes or stick your finger in your nose or lick your finger or something, and the virus gets into your system. It is sort of intermediately nasty. It's about the same ease of catching as influenza, not as bad as measles, and probably worse than chickenpox, for example. But it's uh, quite dangerous, particularly to people with other medical problems and older people. So, for example, the death rate from influenza is about one person out of 1,000 in general, and maybe two or three times that much for older people or children less than 5. For the coronavirus, it's basically zero for children less than 5. It's quite low, still maybe double influenza or triple influenza up to the late 50s, early 60s. And then it climbs quite steeply from 3.5% in the 60s to 8% in the 70s to 16% in the 80s. In other words, one person out of 6 between 80 and 90 will die from an infection versus one person out of 500 uh, at a, uh, your guy's age.
So we have a lot of people, there's a lot of misinformation out there about the virus, and a lot of people, claiming it's a hoax, and there's always a disease in the election year, and comparing it to like swine flu and other strains of the flu.
SARS.
What would you say is SARS? Yeah. What would you say is sort of the difference between this and why there's all the concern that there is in comparison to the other diseases where there wasn't as much concern, and we didn't go on lockdown for those. So why are we going on lockdown for this in comparison to the other diseases?
So swine flu was a possible serious problem, but when the actual influenza hit, we were able to determine that the death rate was no higher than the regular influenza, that 0.1%. And so going into lockdown wasn't useful or necessary. SARS never left the Far East in any significant amount. So we didn't have to lock down because it wasn't spreading around the world. Unfortunately, coronavirus is much more infective than SARS was and much more serious than influenza is. So, if you look at Italy right now, as I know you know, Greg, basically the medical establishment is paralyzed. They're doing nothing but seeing patients with pneumonia caused by the coronavirus, and there are huge numbers of people relatively dying. So, people keep pointing out that there's way more people have died from influenza this year than from coronavirus. But if as many people got coronavirus as have gotten the flu, which is what would happen if we didn't do something about it, then the death rate would be, so the difference between an average of 3.4% with coronavirus and an average of 0.1% with influenza is 34 times. So we're talking about, the average year we see between 30 and 80,000 deaths from influenza. If we just let this thing take its course, we would then expect between 100,000 deaths and potentially 270,000 deaths from coronavirus, and the majority of those being elderly people, and the majority of them having to be in hospital on respirators, because conveniently people with influenza tend to die fairly quickly. Potentially 3 or 4 days. So, you're out of the system, you're not tying up resources. Coronavirus, those people who die can be in hospital on a respirator in the intensive care unit easily for 3 weeks. And so you put 100,000 people or 250,000 people in intensive care units over the next, couple of months and have them stay there for 3 weeks at a time and then finally die. It's completely unsupportable. We don't have that many beds. And, it's already with influenza, the healthcare system in America is stretched. When I have a sick patient I need to transfer to a big city hospital from my little 25-bed hospital here, I can wait anywhere from 2 hours to 2 days to get them in there. Fill up those beds in the intensive care unit with people with COVID-19. I will have to keep all the sick patients here. I have 2 respirators and 1 person who knows how to run them. So if that happens, there are going to be people in my community who come to the hospital, and I basically have to tell them, I'm sorry, you've got pneumonia, you need to be in an intensive care unit, I can't put you there, you're just going to have to die. And that's what they're doing in Italy right now. They're doing their best, and they're still having to tell people, I'm sorry, mom's got this, I can't do a blessed thing for her, she is simply going to die. We don't see that with influenza.
And so that's the importance of the self quarantine and staying out as little as possible. I've had a number of friends who musicians and people who work in the service industry, Lyft drivers, part of the gig economy, who are frustrated with their livelihoods being suspended, but this is essential in stopping the spread of the disease. So what would you say to those people out there who are like, no, I still want to go out to the club and I still want to do these things? What would you say to those people?
The main thing is that if we, sort of pull together on this, it looks from the experience in Korea like we can stamp it out pretty quickly. They had one really bad focus where people from a religious group had gone to China and come back, and they had just a huge spread in the community like we're seeing in New York and like we're seeing in Washington State right now. But they very quickly isolated people. They traced contacts. They tested in a circle around the people who were ill, and they were able to prevent it spreading out into the community at large. And life is going back to normal in China and Korea right now. If we do this, bite the bullet now and do the sensible things, stay 6 feet away from people, clean hard surfaces with disinfectant, avoid meeting in groups of, more than, and that's a pretty arbitrary number. But if you figure, 6 feet between each person and the next person, you're not going to be able to have gatherings of more than 50 people in a venue. If we do those things, then we can damp it out. It will stay in Washington State. It will stay in New York State, and Nashville will not suffer. If it gets into Nashville in a community way, we could be doing this isolating thing for weeks, and that'll be much harder on the gig economy than doing it for 4 weeks now.
Yeah, unfortunately, I've been reading that the numbers have been growing in Nashville. I haven't kept up with the numbers today, but it's here. So
sorry.
Yeah. I mean, it is what it is.
Yeah.
From what I've been reading, it's been spreading across the nation in different communities, and I have a lot of musician friends in Ohio who are struggling with the same thing as the state is going under lockdown. Like I said, I know you're under time constraints. Is there anything else you want the listeners of this to know? Anything else? And also, where they can find your YouTube channel and fun plugs.
Well, my YouTube channel is Dr. Bob's Office, but there's not a whole huge amount there. It's basically demos of musical equipment. So
I mean, most of our followers are Kiss fans, so they might be interested.
I don't know if there's any Kiss-related equipment there.
Are there guitars?
Oh, yeah, there's absolutely guitars and amplifiers.
There you go. It's Kiss-related.
So, the other thing that I hear a lot of people saying is that, hey, I'm young. If I get this, it's just going to be a bad cold. And that is absolutely true. But if you have parents who are not young, you got to stay away from them. If you've got friends who have parents that aren't young, and you give it to your friends and they give it to their parents and their parents die, people are not going to be happy with you. So I would say, bite the bullet now. I know it seems like you don't need to, but you stay home, socially distance yourself, wash your hands, don't touch your face, clean the horizontal surfaces, suck it up for 4 weeks, and we should be over the worst of it.
All right. Well, Dr. Bob, thank you so much. He is a real doctor. He's not a real worm. So thank you so much for being on the show.
Greg, none of our fans are. They might be Giants fans.
Yeah, I missed that part. Yeah. All right.
Hey, I'm sure all two They Might Be Giants fans that listen to the show will love that.
Yeah, that was us, Greg. Us, you and me.
All right. Take care, guys.
You too. Thank you very much.
Later.